Great. So I think we'll get kick-started. So thanks everyone for joining. My name is Krithika Harish. I'm a Senior Associate at Civitas Public Affairs, and welcome to Wellbeing Trust Healing the Nation webinar. This is first in a series of events and webinars that we're going to put together to get the word out about healing the nation. So today we have a few different speakers for you. We have Casey Pick from who's a Senior Advocacy Fellow at the Trevor Project. We have Benjamin Miller, who's the Chief Strategy Officer at Wellbeing Trust. We have Linda Rosenberg, who is the Director of External Relations at Columbia University's Department of Psychiatry. And we have Tyler Norris, who's the Chief Executive at Wellbeing Trust. A couple notes for you before we get started. This webinar is being recorded, but none of the participants, your audio and video is not visible. You'll just be able to see the slides and the speakers. And this recording can be found on healingthenation.wellbeingtrust.org. We'll let you know when that goes up. We'll send you a follow-up email to let you know when that goes up. And you'll also have time for question and answers at the end of this session. So after all the speakers speak, you'll see there is a Q&A box at the bottom of your screen. You'll be able to type in your questions there and indicate if you have a question for a particular speaker, for any speakers, and we'll be able to answer them. So there's a good chunk of time at the end, so please do hold your questions until the end. And without further ado, I want to turn it over to Tyler Norris, who's the Chief Executive of Wellbeing Trust. Tyler?
Thank you, Krithika, and good morning, everyone. My name is Tyler Norris with Wellbeing Trust, and it's a delight to be joining you from the Bay Area in California today. This is a time of opportunity in our country, a time to move from pain in the nation to healing the nation, to move from widespread suffering, from lack of access to mental health care and addiction care, to a country that treats health as a human right and that recognizes there is no health without mental health. This conversation of significance we're going to have this morning is rooted in the reality that we are facing a significant challenge with mental health that is crippling our families, crippling our country. It impacts every single one of us. But what's also happening right now is a normalizing of the conversation and understanding that there are solutions in schools, in the workplace, in community settings. Even in our criminal justice system, there are places that we can act that can have a significant impact. Wellbeing Trust was created 3.5 years ago to advance the mental, social, and spiritual health of the country. As a small foundation, seed invested by Providence Health, we know that the best we can do is catalyze and convene what can be a widespread social movement, where communities, organizations, companies are practicing distributed leadership, leading from where they stand to do what they can do. Next, what you're going to hear in a couple of minutes and see is a framework for excellence. Next slide, please. A framework for excellence that Ben Miller is going to go through that describes what are the vital conditions for intergenerational well-being that are needed to create gardens to grow people in, opportunities for human flourishing. What does it mean to provide affordable coverage so that everyone has access to mental health and addiction care providers as well as integrated care? And how can we create points of engagement where there is no wrong door and access to this care is universally provided? Next, what Wellbeing Trust commitment is in advancing healing the nation with scores of partners across the country is part of what we see as important to ensure that the nation has compelling narratives that help us resonate and align our messages, that we're putting in place metrics and data systems that can help focus action and hold us all accountable to outcomes, that are putting forward new standards for what excellence looks like in whole person care, that is advocating for healthy public policy at the federal and state level and building the kinds of organizations that can advocate and drive healthy public policy, that are bringing more money to this field and helping ensure that it is focused on what the evidence suggests works, and finally, that is helping build the leadership and alliances to build the community and political will to do this with enough reach, intensity, and duration, or enough dose for a population level impact, to move from doing good things to being accountable for outcomes. Our goal is to help save 100,000 lives from death to despair, and healing the nation, and this initiative is a big part of that for Wellbeing Trust. Thank you for being with us in this conversation of significance this morning, and I'm looking forward to the next hour. Ben Miller.
Thanks, Tyler, and good afternoon from New York City. I'm waving at Tyler from across the country. My name is Ben Miller. I'm the Chief Strategy Officer for Wellbeing Trust, and it is my pleasure to briefly describe to you today our work healing the nation. As Tyler mentioned, policy and healing the nation is a cornerstone of our strategy for our foundation. Thanks to our partnership with many folks on this webinar, many folks across the country, including the Kennedy Forum, Wellbeing Trust has been able to take a previous version of a Congressional Members Guide focused on mental health and addiction, update it, and ground it in a framework that allows for policymakers and their staff to see places where they could pursue policy that aligns with a truly comprehensive and integrated vision for mental health. Over the last 2 years, in partnership with Trust for America's Health, Wellbeing Trust has been tracking deaths of despair. These are the premature deaths due to drug, alcohol, and suicide. These data are a beacon of sorts that we as a nation are going in the wrong direction. We're losing more lives to preventable causes than we've ever lost before. And while just a few weeks ago, we learned from the CDC that life expectancy had risen for the first time since 2014, and we saw some declines in things like drug overdose deaths, we still see a rise in deaths to suicide and alcohol abuse. Our country has a problem there. And we have a problem because we're tinkering at the edges and pursuing workarounds that simply won't suffice. Our response must be one that is grounded in community and connects the dots between all the places that people show up with mental health and addiction needs. That's where healing the nation comes in. Some of you may have been with us in Washington, D.C. a couple of weeks ago. At that event, Wellbeing Trust, in partnership with the Kennedy Forum, Center for High Impact Philanthropy, Mental Health for Us, Civitas, and many others, we released Healing the Nation. And it was our call to action. It was a come-together moment. Our focus at this event was on the policy, and each policy recommendation was really grounded in a framework for excellence that you see on the slide in front of you. This framework offers a way for Congress to see different ways to approach mental health, because when healthy community conditions on the left side, good coverage, and inclusive policies are all in place, we can achieve positive outcomes that improve the mental health and well-being of all Americans. And so we posit that if we're truly serious about tackling mental health and addiction in our country, we must leverage all the places and spaces that people present with needs and provide support accordingly. We must also see these needs as including risk factors as well as mental health conditions, and focus on the upstream factors that can be prevented or mitigated, that can prevent or mitigate later problems. And in each of these areas of opportunity, there are policies that stand to support, or in some cases might be barriers for successfully offering help to those who need it. So let me take a minute and walk through Healing the Nation to provide some specifics as to what it proposes and how we can advance policy. As I described, this policy guide approaches the issues around mental health with a vision of what excellence could be, and leads us to not figure out how we can just tinker more, but to do something truly comprehensive. Our guiding principle for this framework and guide is that health policies and solutions must be inclusive enough to ensure that all places effectively promote mental health. This includes from creating positive dynamics that prevent conditions from developing in the first place, to providing access to culturally and linguistically appropriate services when the needs are there, to define outcomes and collect data to make sure that equitable and positive outcomes are achieved, and most importantly, really supporting recovery in whatever form it takes for the individual. This approach also exists on a continuum and recognizes that some people have more severe needs than others. One-size solutions will not fit all nor serve all communities. That's why our framework focuses on multiple places for engagement within a specific emphasis on 5 main entry points for policy. So as seen on this slide, we highlight 5 places where policy could be more responsive. Health systems, which includes places like primary care, ambulatory outpatient settings, hospitals, and our emergency departments. We highlight policies specific to the judicial system, whether this be jail diversion programs, treatment programs, while an individual is incarcerated, or how to provide wraparound care and coordination once a person has been released. And of course, we lift up policies and solutions for our education system. We know that the age onset for mental illness often begins in adolescence, so why not create stronger mechanisms for supporting our youth in the location they spend most of their time? Schools can also be an important place for learning about mental health, screening for problems, and even accessing services directly. There's a ton of evidence out there, and evidence-based approaches better prepare students to access effective help. Federal policy can help schools integrate adequate mental health resources to identify and address students' needs. And our workplace, the buildings and offices that many of you are probably in right now, what policies would allow us to work better, to have mental health supported within that environment? We know that work, unemployment, and disability all have serious implications for mental health, and Healing the Nation offers specific ways to maximize mental health outcomes across all of those situations. We know that workplace factors, specifically workplace culture and climate, can impact on mental health. So on-site workplace interventions and policies that support that are really effective and should be pursued. And finally, last but not least, is what we call whole community. These are broader issues like stigma, issues about culture. They must be addressed, or a lot of the policy interventions will fall flat if we don't do something in there. Each of these entry points must be connected to one another in service to a broader vision for mental health, one where a person doesn't get lost. In Healing the Nation and on the website, healingthenation.wellbeingtrust.org, you can see concrete examples of these policies. And here's just two that I pulled. These are from our healthcare section. So let's talk about primary care for a second. One, we know the importance of primary care for the delivery system and how much mental health is seen in that settings. We propose, and you can see the policy here, that the federal government require that all primary care payment models initiated by CMS or through state waivers include the consideration of whether that model would be better to integrate mental health. A game-changing type of approach that would allow resources to provide more integrated care on the ground. And for hospitals, let's make sure that the federal government ensures that hospital payment models and quality programs incentivize assessing mental health at every interaction as a vital sign and push novel payment models within those settings to also support teams. In the guide, there's much more that you can see. Take a look at the website, find your entry point that's most interesting to you, and download the fact sheets on that topic. While we have a report and something you can go into detail on, the website is meant to be there as a shortcut to find the solutions in a timely manner. So let's work to bring mental health to the center of our redesign. So in closing, Wellbeing Trust wants to continue to engage with you. We'll be looking for opportunities for engagement with other organizations. Want to sign on to what you've seen here? Let us know. Want to use this guide for your organization's policy work? Let us know. Over the next year, we'll be working to broaden the coalition who can take action on the policies, as well as to begin to prioritize where it makes the most sense to start. In addition, on May 1st, Wellbeing Trust will be hosting an event in California to really go deeper on some of the policies that we call out in our focus population sections on Healing the Nation. We know there's more to do in that space, and we want to bring together experts to help us do just that. And finally, for those interested in tailored presentations on Healing the Nation, or you just want to have more info on getting involved, you have questions about what's being talked about today, please contact Krithika, and her email is going to be right there, actually in front of you. So my thanks to all of you for what you're doing to help advance mental health and for what we might be able to do together to help heal the nation. I will now turn it over to Casey Pick, Senior Advocacy Fellow at the Trevor Project. Casey?
Good afternoon, all. Thank you very much for having me as part of this exciting conversation. As Ben stated, my name is Casey Pick, and I'm the Senior Advocacy Fellow for the Trevor Project. The Trevor Project is the world's largest provider of crisis intervention and suicide prevention services for lesbian, gay, bisexual, transgender, queer, and questioning youth. Every year, we serve hundreds of thousands of contacts from all across the country, reaching out to us through our 24/7 telephone lifeline, online chat, or text-based services. And in addition to providing services through our helplines, we also have an education, advocacy, and research department, all of which are dedicated to the mission of ending LGBTQ youth suicide and to advancing our community's mental health. So part of what I do in our advocacy department is I focus on 3 key issue areas. The first and best known is combating the discredited practice of conversion therapy, which is an abuse of mental health practices to try and change someone's sexual orientation or gender identity. But we also work on encouraging the adoption of suicide prevention policies in schools across this country. And also, finally, on working to improve our data collection on sexual orientation or gender identity so that we can create evidence-based policies to better serve all of our communities. Next slide. So I'm speaking today just to really show an example of how the Wellbeing Trust and the Healing the Nation program and report speaks directly to the LGBTQ community and our needs. As many people are aware, we suffer serious disparities in our access to healthcare, our outcomes from healthcare, and often experience discrimination while receiving mental health care, all of which contributes to lower rates of mental health overall. Part of this is, as I mentioned, negative impacts that will come from just the long history of having treated sexual orientation or gender identity as a mental illness. And while we are decades out from that in the case of homosexuality, and at least 5 years out since gender identity was removed as a disorder from the diagnostic manuals, you still have a long legacy of distrust for the mental health community. And that is only worsened for the segment of our population that has experienced conversion therapy or been threatened with it. So what does this turns out that LGBTQ people, particularly youth, are shown to be at much greater risk for certain mental health challenges, including anxiety, depression, and suicidality. And it's important for us to note that this is not because being LGBTQ is in itself pathological, but stems from the experiences with anti-LGBTQ discrimination, isolation, and stigma, which of course can be compounded by intersectional identities like being a person of color. And finally, these disparities are exacerbated by a severe lack of LGBTQ-informed healthcare. There's a lot of just misunderstanding and lack of understanding out there. Next slide. So what this winds up with is, I'm a data person. Trevor as a whole is all about data, and that means I'm going to throw some statistics at you right now. In 2019, the Trevor Project released our National LGBTQ Youth Mental Health Survey. 34,000 respondents between the ages of 25 and 13 who are LGBTQ identified answered this, and we came up with some stark data. 39% of LGBTQ youth had seriously considered attempting suicide in the past 12 months. That number is greater than 50% for transgender and non-binary youth. 71% of LGBTQ youth reported feeling sad or hopeless for at least 2 weeks in the past year, which our folks know is a signifier of possible clinical depression. And just for spice and interest, 76% of LGBTQ youth felt that the recent political climate impacted their mental health or their sense of self. So that speaks to me of the importance of our political conversation and the various different ways that we can have a positive effect, even outside of the actual medical or mental health spaces. In addition to the Trevor Project's national survey, I would point you to the 2018 Center for Disease Control Youth Risk Behavior Survey, which really speaks to where we're at for youth suicidality. This only speaks to lesbian, gay, and bisexual because the YRBS data for transgender and gender identity is just very low or in many cases not present. But know that for whatever the number is for sexual orientation and LGB, it is likely higher for transgender youth. So LGB youth are almost 4 times more likely to have seriously considered attempting suicide than their straight peers, have made a suicide plan, attempted suicide, or have been injured in an attempt than their straight peers. So that's a real problem and something that we need to be addressing. Next slide, please. So further evidence of this. At the Trevor Project, we estimate that there are 1.8 million youth between the ages of 13 and 24 who seriously consider suicide each year. And now I want to speak a little bit to why it's important that we have a particular focus and sometimes offer specialized services that address the needs of a specific population. In this case, LGBT, but this also applies to other populations. I'm thinking Native Americans, I'm thinking folks who are connected to the military, et cetera. 87, in a survey that we did of youth who had reached out to us to evaluate our effectiveness, more than a quarter reported that they would not have contacted a helpline, another helpline, if the Trevor Project did not exist. So this is 26% of youth who had contacted us saying that they needed to go someplace where they knew they would be understood. Similarly, in our national survey, 87% of youth said it was important to them to reach out to crisis intervention organizations that focused on LGBTQ youth and people. And there are good reasons for this. Everything from having experienced discrimination at the hands of medical or mental health professionals to simply meeting somebody who's going to have been there and have understood what they're going through. And when you focus even further at the intersectionality of different identities, that need for cultural competency and for adequate training becomes even starker. Black LGBTQ youth are less likely to receive mental health care than the general LGBTQ youth population, despite having similar rates of depression and suicidal thoughts. And when we come to other possible areas of intersection that are also important, we did a research study recently saying that Native American and Alaska Native LGBTQ youth were 2.5 times more likely to report a suicide attempt compared to white non-Hispanic LGBTQ youth. Other key areas that need to be kept in focus are incarcerated populations, people who use substances, transgender military members, and people who've experienced unemployment and poverty. And all of those areas are actually at a higher rate, a disproportionately higher rate for LGBT populations. And yes, that includes transgender military members. Trans folk are more likely to serve in the military than their cisgender peers. Next slide. So what are we going to do to address these issues, and what are the proposals advocated by Healing the Nation? What is tremendously valuable about this document to me is that it does raise up the need for a national comprehensive approach, which we know that the experience of LGBT people across this country varies drastically if you are in San Francisco as opposed to Santa Fe. So there are so having a national comprehensive approach to this will be significant to improving the quality of life wherever you are and whatever the history of acceptance is in that area. We very much are excited by the support for equity-focused research, which means that we can actually push for better data on a person's sexual orientation or gender identity. All of those statistics that I was able to read off about suicide attempt rates, we only have data on attempt rates because we do not have data on the sexual orientation or gender identity of people who have completed a suicide. We are supposed to have that data. It is something that we can ask under the National Violent Death Registry System, but we simply are not collecting that data, and we desperately need it to have improved policies. And of course, calling for an end to discrimination as part of the whole community effort, cultural competency training of underserved communities, and greater respect for mental health overall will have a huge difference. Next slide. So the policies that are specifically called out in the Healing the Nation report of setting strong norms for safety and inclusion and having just better work on creating a safe environment in our schools, in our workplaces, in our communities. All of these things will be tremendously significant to improving the mental health of LGBTQ Americans and just putting a spotlight on this issue. I'm happy to answer further questions at the end of the presentation. Thank you so much.
Thanks, Casey. Next we have Linda Rosenberg.
I just took myself off mute. Good morning and good afternoon, depending upon where you are. I'm talking to you from New York City, as Ben did. I am currently on the faculty of Columbia Presbyterian's Department of Psychiatry, where my focus really is taking research to help shape policy and ultimately improve practice. But my major time that I spend is really on the delivery and financing of mental health and substance use services in both the public and private sector. I spent the last 15 years as president and CEO of the National Council for Behavioral Health from June 2004 to June 2019. It's an association of 3,300 mental health and addiction organizations that serve the safety net population in every community that have serious mental health and addiction needs. I think what I bring as a result of that, of my current work, my work before that in state government in New York, is really an appreciation of where we are and where we've come from. Next slide. I think Tyler talked about the progress we've made, even though it doesn't always seem so. If you look at Healing the Nation, one of the reasons I'm excited about it, Columbia is excited about it, so is the National Council, is because it's a moment in time where people are ready to take action. We no longer whisper about mental health and addictions. People everywhere, young and old, famous and not, are really telling their stories. And people are hungry for information. Mental Health First Aid, which is a course that tells you how to respond in a crisis, gives you information about local resources. More than 10.5 million Americans have taken a Mental Health First Aid course. And I think that is a demonstration of the interest in this topic, of people saying we want to understand mental illnesses and addictions, and we want to develop solutions for what are very complex issues. You know, in many ways, it's the last frontier for us. We understand the heart, we understand the lungs, and all the various organs. We have very standard practices for the illnesses that go along with those disease states. We don't have the same thing for mental illness and addictions. Where you are very much depends on the treatment you get, and we'll get back to a little bit more about that. The other thing is we have treatments that are highly effective. For people who are experiencing psychosis for the very first time, we have coordinated specialty care. We now understand the impact of trauma on people's mental health and addictions. And we have medication-assisted treatment for the first time, widely available to people with addictive disorders. We have made progress, and as a result, many people are doing better. Next slide. But still, every week, and I'm sure for the other panelists it's the same, I get a call from a person or their family or a close friend asking how and where people can get help. People who are both in crisis, as well as people who've had long-standing mental illnesses and addictive disorders and are really looking for being able to do things like return to school or return to work. Where do they get help? Where do they get support? For too long, really, the dominant health policy landscape has been focused on physical illnesses, and addictions and mental health were really afterthoughts. What we need is a robust policy agenda that really elevates these disorders, and that's what Healing the Nation does. Healing the Nation really brings together a wide range of issues and solutions, and I think it was Ben that talked about in this coming year really prioritizing what are we going to focus on first. What are we really going to try to move? Not only at the national level, but what people can do in their states and in their communities. And I think that's what makes Healing the Nation so powerful. It is a dense document, but it is the only document I've seen that really puts all the pieces together. And so I encourage people either to read the entire document or to look for the sections that speak to the issues that are most important to you, just the way Casey did in terms of the work that she does. I think one of the things we need certainly, and I think again, you know, Ben went over, is that mental health and addictions aren't just going to be dealt with and supported in health systems. Health systems are very important, but we see workplaces and schools are all really moving their attention to mental illnesses and addictions, both around developing resiliency in schools and in the workplace around things that affect the workplace, affect the environment and people's ability to do their jobs and move beyond their jobs in the workplace setting. I think it was either Tyler or Ben who talked about jails, prisons, probation, and parole, which really represent for some people the failures of treatment. And the fact that we can engage people in those settings and deliver services as part of probation or parole or an alternative to incarceration, those are really things we can do that we couldn't do before. And I think the time is right. Next slide. I think in addition to, really our understanding of the settings of care, the other thing Healing the Nation does, it really reflects our understanding that clinical care is only part of the equation. And I think, Tyler, you've always been very eloquent about this, about the impact of where we live, how we live. We know that the richest people in our country live 13 years longer than the poorest people in our country. In a place like America, North America, the United States, that's a disparity we can and need to address. And mental illnesses and addictions, alcoholism, suicide are very much a part of that really disparity in life expectancy. I think the other thing that Healing the Nation does is it makes very clear what are the specific interventions we can do in legislation, regulatory actions, and policy that we can take right now. Next slide. Ben talks about two important things. And actually, it was Healing the Nation. I'm fortunate enough to be on the advisory board, and it's the place where it must be 2 or 3 years now that I began to think about the fact that really mental health is a vital sign. And that, when I go into a doctor's office or anyone who's listening, we get our blood pressure taken. They weigh us. Things that are basic to coming in, whether I'm coming in for a well visit or I'm really coming in because I have a sore throat, they're still going to do those vitals. And I think one of the things that, Healing the Nation calls for is for assessing someone's mental health in every interaction and building that in to payment models and quality programs. We have an array of payment models and quality programs that are promoted in the public sector by the Centers for Medicare and Medicaid, in health insurance programs by foundations, in the kinds of programs that they fund. And can we begin to think of assessing mental health as a vital sign? I think the other thing that Ben talked about was sustainability for integration. So we've been working on integration. Ben worked on integration way before he was part of the Wellbeing Trust, and really is the person, I think, who very much brought it to the forefront that primary care must include assessment and treatment for mental illnesses and addictions. And we've come some distance. We have collaborative care codes where we can bill for coordinated care. But I was just at a presentation of a health system very committed to collaborative care codes, very committed to integration. They still can't sustain it financially. We need to understand that we can have policies and we can build into our reimbursement structures really incentivizing healthcare systems for delivering integration, including federally qualified health centers and rural health centers, which really are the basic safety net in our communities for primary care. I think the other thing we can do, we have a demonstration project which sets up a system similar to federally qualified health centers, but for people with very serious and ongoing mental health and addiction disorders. And it's called Certified Community Behavioral Health Centers. Through Healing the Nation, we can make that network nationwide. And we can ensure whether you're in New York or Columbus, Ohio, or San Francisco, you're going to get state-of-the-science treatment that's going to be coordinated with your physical health. I think the other thing that Healing the Nation talks about is how do we incentivize municipalities that are addressing affordable housing. Because mental illnesses and addictions strike young, people who are born into middle class and upper class families are driven into poverty. because they don't fulfill their educational promise or their work promises. And so poverty is definitely, a coordinate of mental illness and addictions for many people. And if you don't have a place to live, then how can you recover? How can you go back to being or start to be part of the workforce and having a life of, love and work, things we all want for those we care about? And so affordable housing, Ben and Tyler know better than me. They're based out in the West Coast, is that in a place like San Francisco, as I understand it, they just defeated actually a referendum or a ballot measure that would have changed the zoning density. And so if we don't have housing, we are going to have people on the streets and in jail, the very thing that often the public is most concerned about. So I think Healing the Nation can really be and is becoming a leader in trying to solve this problem for a population with behavioral health disorders. I think the last thing I want to mention as an important policy change that Healing the Nation can address and really incentivize is the whole workforce issue. One of the things I tell people who are involved in specialty mental health and addiction care is that we have a workforce really crisis in every industry right now. We have full employment. Companies that are trying to attract young talent are offering an array of incentives. Remote employment is only one of them, but they offer sabbaticals if you work for 3 or 4 years. They offer, signing bonuses. We're competing with those for-profit companies and industries that are making lots and lots of money at a time where our salaries really are very restricted. And in the end, people need to support themselves and their families. So what do we do about that? How do we at least begin to incentivize training programs, increase loan forgiveness programs, all the things, have an equivalent of public service AmeriCorps for people who are working in behavioral health, all those things that can get young people excited and willing to give years to the mental health of their country. Those really are just a few of the issues that Healing the Nation is taking on. And I think, I spent those 15 years in Washington and know many of the organizations that spend a lot of time on the Hill. And there is nothing in Healing the Nation that isn't consistent with their agendas. I think Healing the Nation is a place that brings those pieces together. And it really is able to articulate our community, the community of mental health and addiction service providers, and what we need, but more importantly, what the people we serve need, and how we can really be a unified voice. Next slide. I didn't want to end without talking a little bit about technology. I think it's definitely embedded in Healing the Nation, but I think we can spend even more time and attention thinking about the policies that will extend our workforce by using technology. If you think about any industry, right, whether it's Amazon that will deliver things to my home while I'm doing this webinar, things I ordered last night, or it's Uber that I took to the airport this morning, or it's, my stop at the bank where I haven't seen a teller in years. Actually, I very rarely go to the bank except to go to the ATM. I think we're in the same place they were 5 or 10 years ago. I think healthcare very much is on really the cusp of a technology revolution. And I have just some of the companies that I'm involved with and many others are involved with who are looking to combine high tech with what I call high touch. And the things they're offering are immediate access. I think as a nation, we are a nation that is really expecting things when we want them. And to say, I'll give you an appointment in 6 or 7 weeks is unacceptable. There are urgent care centers for physical conditions on every street corner. I urge, and I think Healing the Nation speaks to the fact that we need to be able to give services when people want them and where they want them, and technology can help us do that. Again, millennials want to work from the comfort of their home. Just like we're doing this webinar, treatment is going on from the comfort of people's homes or offices out into both rural areas, but also right into, urban areas. And I think the most important thing that technology will do, it will bring transparency to a part of healthcare that has been very opaque. I think one of the things, we come from a history of delivering services behind closed doors, of, Casey spoke so eloquently about her, dedication and use of data. Those are all things we can collect with technology in ways we couldn't before. So I think Healing the Nation, it will bridge where we are to where we want to be, using really the passion and the advocacy of patients, families, and all of us who work in mental health and addictions. And I think they will also help us use and embed technology in much of what we do. And I look forward to the dialogue now and to answering questions.
Thank you so much, Linda. And thanks to all the speakers. Thanks for speaking into your expertise. This was really, really informative. We have a couple questions already typed in, but I want to encourage everyone to please type in your questions. We have a good 15 minutes to answer all the questions, so please do. We're already getting a couple more in. So I'll start off with this first one that we got, and it's really around policy research and establishing the evidence base necessary for government to invest in policy. So the first question here is, and I think this is for, let's say, Ben, I think this will be a good question for you. For example, for your examples on policy suggestions for primary care and hospitals, do you have the evidence base necessary to convince policymakers? In our work, policymakers need this info to advocate for resources, but feel they don't have it, and we've been putting it together state by state to help them.
Yeah, thanks for the question, Brian. One of the most important things that we wanted to do with Healing the Nation was we wanted to ground every policy recommendation in the evidence. There's a lot of belief-based policy that occurs on a daily basis throughout this country, and we really wanted to go away from that and have evidence-based policy that can be brought forward. In the areas of mental health, specifically around primary care and some of the integration work, there are close to 30 years of research showing how effective this is as a model of treatment. And when we stand on the back of that evidence and we help make the case to policymakers as to why this should be the standard of care, that's what Healing the Nation tries to do. If you look under the sections on the website at least, and in the guide, you can find all the citations that help you understand or show the evidence base associated with that topic. Now, the business case sometimes can get a little tricky, as many of you know, but the good thing is there's robust business case or economic cases for practically anything to do with mental health. Every time you address mental health, the economics look really good for everybody. And that's a positive thing for policymakers. It's a positive thing for people. So thanks for asking the question. And I don't think that we need to invest so much more. Obviously, always invest in research. It's a great thing. Study more to your heart's content. But we know enough now to be quite dangerous in policy. Yeah. And I don't think that we have to necessarily go back and reinvent some of the wheels. And I'll let my colleagues respond to that as well.
I'd like to add something, Ben, because I think you're spot on. I think legislators often use that as an excuse. They say they don't have enough evidence. I don't think any other disease goes into a federal, state, or local office and says they're going to save money in another disease. I've actually encouraged organizations to stop using that. And I think Ben is right. We have ample evidence for all of the interventions, far more evidence than things like back surgery and knee surgery have, in fact. And so I don't think we should be ashamed. I think what we don't do as effectively is use our advocacy. Numbers count when you don't have a lot of money. And so we need to make sure we are not only in their offices when something, like Wellbeing Trust perhaps has a Hill Day, but we're in there when they're home in their local communities, that we invite them to our centers, that we have relationships and they know they can call us when one of their constituents has a problem. And that if we're able, we volunteer and donate as private individuals to the campaigns of our champions. That is really how you move policy. I think we've got plenty of evidence.
Great. And then just to finish Brian's question, I know he also asked about whether you're aiming to establish an integrated database for mental health that scales nationally to locally to guide policy solutions.
Yeah, that's a great question too. So we started with the congressional guide and the framework because we believe that there needs to be kind of a national standard that's set, at least initially, for policy. Our vision over the coming months and over the next year is to take this and begin to tailor it specifically to states. Many of you that do policy understand that there's a lot of action that can be taken at the state level. And as long as it's consistent with an overarching vision or framework and the evidence base, it's a really wonderful place to begin to take advantage of what we've started here with Healing the Nation. So we will be doing this in select states over the coming months. We welcome partnership or ideas with many of you on this webinar because it is essential that we begin to kind of scale up both locally to national and national to local. There has to be some transition and ability to connect there. So thanks for the question. And again, colleagues, welcome your comments on that as well.
Well, the next question is from Sharon Chappelle. How does the Wellbeing Trust framework connect whole family well-being across health and school sectors?
So I'll respond briefly on that one. It's always the individual in the context of family and family in the context of community. Anything that goes beyond that, or it is not inclusive of that, is really missing the point. So what we have to do is to recognize that a lot of our payment models, a lot of our policies are very focused on individuals. And if you're a child and you're seeing your pediatrician, and it might just be that the mom that's with the child has symptoms of depression, we have to have mechanisms that allow for us to treat the family in a much more comprehensive way. We make it too difficult for people to get access to care. We make it too difficult for us to finance the appropriate things for our families. So if we are not inclusive of family at the heart of this construct, at the heart of these policies, then I feel like we've missed a major step. And frankly, as I said already, this is a challenging proposition because of the way that we've set up insurance, because of the way that we set up delivery mechanisms. It doesn't mean it's right, that the way that we've done it. It means that we have to take into account much more of that family-focused type of approach and interventions. Thanks for the question.
And Ben, this is Linda. I would just add that that's true even for people with the most serious mental illness and addictive disorders, that we've made it very hard, particularly over the last 10 or 15 years, to really include families who in most cases are the ultimate caregivers. And, we've something I call hiding behind HIPAA. We've hidden behind HIPAA too long. Most people, if you take the time to ask, are very willing to talk with their family and have their family included. I think we really need to raise our sensitivity around this issue.
At the same time, when we're talking about families, this is where it's important to view that element of inclusion very importantly, because if you're talking about a same-sex couple, they have to be able to feel safe coming out to their physician, informing them that they have a husband or that they have the same-sex partner. So you have to have that kind of inclusion-based foundation before you can really use a family-based or community-based structure wisely and effectively.
It's a great point.
Thank you. So the next question is from Samantha DuPont. She asks, what are your thoughts on growing the peer workforce? How can policy support this?
Linda, do you want to start with that one? I know that's something you know a lot about.
I do. I know some about, and I think we have an opportunity to not only grow the peer workforce, but promote the peer workforce. And what I mean by promote it, I mean allow people to have opportunities to move forward in their careers. You know, we can't use peers as a cheap workforce. I'm very blunt, and I get worried that sometimes that's what we've done. And so we need, when we're talking about workforce opportunities and training, do we have career paths for people who started out perhaps as peer counselors, peer supporters? What are they going to do next? Can they go on to nursing school and medical school and social work school? And I would very much urge Ben and Tyler and Healing the Nation to think about that. I think the other thing is we need to think about peer workforce as part of the health workforce. Health workers are used all over the world. And I think because we have such a dearth of staff, we need to think beyond just the person themselves who's had a mental illness or addiction, to think about family members and friends who've been touched as well, to think about people new to our country who can work in their communities and with their communities as health workers and then offer them the opportunity to move on. I'm actually involved here in New York and talking with the commissioner about the advancement of peers and health workers. I'm particularly interested in nursing opportunities because often for immigrants and for people who are low-wage earners, that is really a path into moving ahead in terms of socioeconomic status. So I think there are things we can do, and I'm hoping Healing the Nation and Ben and Tyler will help us really move that forward.
Thank you. So Linda, this is another question for you from Samantha King. She asks, I assume there are some concerns about the use of technology in this space. Can you address how some of these companies are trying to overcome these concerns and how they are integrating with the rest of the health system?
Yeah, so I actually, we have a new initiative here at Columbia called Columbia Mind Ventures, which is serving really as a resource to some of these startup companies and these companies that are delivering either direct to consumer or they're working with organizations around using their data more effectively, around connecting people 24/7, you know, a host of different kinds of interventions. I think, I almost think we've reached a tipping point. I don't think people are so afraid this is going to replace them. I think it's about, can they afford it? And I can speak most clearly to the specialty sector, where if you want to bring technology into your center so you can stay in touch with the people you serve, you know, more frequently, so you can see them at home so they don't have to travel long distances, one of the issues is, how do you pay for it? And that's where Healing the Nation is going to be a tremendous help. And it's where we've not yet partnered with private industry. These are companies that are supported by venture and private equity. They have some deep pockets, and I think we need to think about how we get them involved in the kind of advocacy we need to do and really use their resources. And maybe that's something we can talk about and look at. I think that time has come.
Absolutely. At the Trevor Project, we actually have some significant experience with partnering with technology companies, whether it be AT&T helping us to build out our back end to get us to a place where we were able to go 24/7 with our online text and chat services, being able to be there and provide something that vastly increased our accessibility to our particular populations. There are Obviously, we talk about how millennials hate to get on the phone and would much prefer to text, but when you're also thinking about that for your LGBTQ population, these are youth who are calling us and sometimes wanting to say out loud for the first time that they're gay, or maybe not wanting to say it out loud in case they'd be overheard. So that's part of where the ability to build out and to utilize something like text and chat is valuable. Likewise, we also have a major grant that we've received from Google to work on incorporating AI into part of our system, not providing the services themselves, but to making us more effective as we provide our services. And that's been something that is tremendously exciting and will be an important part of providing care in the future, we think.
Yeah, agreed.
Great. So we have a couple more questions from Blair Dudley. I'm going to answer this one quickly so that we can move on to the next one. But Blair asks, are you planning to invest beyond primary care into mental health and maternity care? And actually, this is one of the focus populations that is addressed in Healing the Nation, maternal mental health and postpartum care. This is, as Ben mentioned, in May, we hope to be digging in a little bit deeper into impacted populations. So Blair, please do stay in touch and we can get in contact with more information about the May event. But healingthenation.wellbeingtrust.org does have some information on maternal health. The next question we have is from Kristen McQueen. And she asks, how can we better instill trauma-informed mental health approaches into school-based health centers?
Yeah, I'll start and then I'll turn it to my colleagues because this is an important one. I argue that, we should be trauma-informed everywhere. It's one of the beautiful things about the framework is that if we believe that mental health is going to show up in all the places that we would expect or not expect, schools, healthcare, prisons, et cetera, why would we not want to be trauma-informed everywhere? And even in our own communities outside of traditional delivery settings, we must be more informed on how to address issues of trauma. So in the report, in the guide, we do call out specific ways through legislation, through policy action, that we can begin to look more at how to provide a trauma-informed approach. And this one's specific to schools. And so this one's around amendment to the Head Start Act and looking specifically at ways that we can support that. But to the point, and I think that this is important for everybody to understand, we as a culture have got to become more trauma-informed. If we're really serious about addressing some of these intergenerational issues, we have to be able to respond more appropriately to folks that have gone through trauma. We know it's key, and my colleagues, I'm sure, have other ideas on this one, but we will likely be building off of this more in the future, so thanks for the question.
One of the things, Ben, that I worry about, it's not probably very popular, is there is a lot of work around trauma-informed care in schools, in all settings, in primary care. The National Council has been involved with it for years. I worry about our not having enough skilled staff to actually treat trauma. And I think we need to also look at that. Trauma-informed is one thing, but you also need to be able to treat people that really are affected by their experiences, often interpersonal experiences as children and as adults, and what are the treatment interventions that have the most evidence. I think it's an area where we could focus on some evidence-based treatments.
Part of this is just equipping our schools to have a policy in place and have some idea of what to do. So in terms of how do you respond and how are you trauma-informed, one of the basics I would say is making sure that every school district in this country has a suicide prevention policy in place that would incorporate elements of suicide prevention, intervention, postvention, teacher training, so that they can know what they're seeing. And of course, emphasis on higher risk populations that call out the needs of populations, oftentimes those that have undergone trauma, whether that be an individual who's had a suicide in their family or their immediate community, on over to LGBT youth, military folks. Various different kinds of traumas exist. And for our schools that are so overburdened and have so much going on, if you don't have the requirement for a policy in place, this is one of those things that keeps getting pushed off until tragically you need it, and then it's too late.
Yeah.
Thanks, Casey. And I know the Trevor Project has a school-based policy for that, so maybe that's something we can link to folks in a follow-up email after the panel.
Absolutely.
Great. So I want to be respectful of everyone's time. It's 1:01, and Gary, I see that you wrote a comment for the panelists. We do see that, and we'll make sure we read it. I just wanted to quickly address some next steps before folks sign off. A reminder that the webinar recording will be available on healingthenation.wellbeingtrust.org. We'll send you an email as soon as that goes up, so you'll have the recording to watch again or share with your colleagues. Again, save the date for May 1st, where we'll have a Healing the Nation Summit in San Francisco. If you've attended this webinar, we have your email address, and we'll make sure you get the information on that. And as always, for more information, you can always send me an email at kharish@civitaspublicAffairs.com. The email address is on your screen. Thanks again to all the speakers and all the participants for addressing this really important topic, and please do visit the website and use the information there.